a really good opportunity to have a conversation around the topic we've got there about how we shift the dynamic and move from always chasing our tails to a health and care system that looks slightly different. And I'll leave Claire to talk through how we're going to progress with the session. But I wanted to introduce myself and just briefly the members of the core Healthy Communities Together team in Coventry, and just tell you a little bit about HCT, Healthy Communities Together. So your invitation might have said from Grapevine, but that's because Claire, as you've already seen, is our technical lead, and we're sending out the invitation. So we're coming together today. Convening this as Healthy Communities Together Coventry. Healthy Communities Together is a national lottery funded and King's Fund supported piece of work. We're one of 5 partnerships across the country wanting to come together to really explore partnership working and how we can do something different with our communities, with our frontline professionals, and with the big system players, so health and care, across our patch, to really try and explore how we do things differently, acknowledging that is not easy. If the answers were there, people would be doing it already, and also acknowledging that in some of the work we've done, in our work in Willenhall, which is where we've based quite a lot of our community-based work, there have been difficulties. Things haven't been as easy as we expected, but we've had some great successes. So we've done some very granular community work, working with people with mental health conditions and as part of the community there. But we've also worked with frontline health professionals, and this is our attempt to continue our work with those of you working in our system at a strategic level or on the front line, and bringing people together to see how we can bring about change by altering perhaps the way that we think, and addressing some challenges together. So that's who we are as a partnership. I'm Sarah Raystrick, I'm part of the core team, and I'm a GP in Coventry. You've met Claire. I'm going to ask some of the others to give a wave. So I've got Debbie Dawson, who is on the partnership, and she's there representing the ICB. We've got Blair Roberts. I'm not sure if Blair's been able to join us today, but Blair is part of our core team, and he is there representing Coventry Place. We've got Valerie D'Souza, who represents, she's there for public health and the local authority. Then we've got Andy, and I think I've seen Andy, there you go, Andy Smith and Eleanor Capel, who are part of our core team from CWPT. And we have Mel, who's joined us on the core team as well, who's part of Grapevine. So that's who we are. I think hopefully set the scene on why we've brought people together in brief, and I'll hand over to Claire so we can proceed with the conversations that we're going to have for the next little while. Thank you.
Okay, thanks, Sarah. So I just wanted to say a little bit about why are we bringing people together? Why would we do this? And I think as HCT, what we've noticed and what we're learning about as we do our work is the challenge of influencing the local system towards a longer term vision for health and care services at the same time as they have to deal with the here and now challenges of service delivery and all the many kind of short-term problems that take up all of your energy and your focus and your time. So what we wanted to do was press pause and get a chance for us all to explore our shared experience of systems change and the challenges and the opportunities that exist for all of us as a system together to improve health and care outcomes. And this is a really exploratory conversation. All you need to do is bring your experience and your thoughts, your reflections, your ideas on change and our local landscape. So it's really mainly about you having that kind of conversation together, perhaps with people in the system that you wouldn't normally meet either in your day-to-day work. In order to sort of get the juices flowing, get our thinking caps on, we thought it would be nice to have a couple of speakers in conversation with each other, and we've really delighted that Susie Bailey from the King's Fund has been able to join us alongside Joe Underwood. Susie she heads up leadership and organisational development at the King's Fund and has a great career history of working on leadership for improvement and change in the NHS. And then we have Jo. Jo has worked for 20 years in the NHS, and she's been the transformation leader in the Gloucestershire ICS, and she currently convenes Healthy Communities Together. As we explained, it's a national programme. She convenes Healthy Communities Together over in Gloucestershire, working in that system. So yeah, over to you, Susie and Jo.
Great, thank you very much, Claire, and hello to everyone. It's lovely to be with you today, and you know, this is very much about your time together and exploring your relationship. So thank you very much for making yourselves available for today, and we hope that you enjoy the conversations that follow. So hi Jo, how are you today?
I'm very well, thanks Susie, and hi everybody. It's really exciting to be here.
So Jo, we've got about 15-20 minutes just to explore a little bit your experience as an NHS manager particularly, and we are obviously having this conversation on the day that is the 75th anniversary of the NHS. You can't get away from that news today, in the newspapers, on radio and more, lots on Twitter today about that. And fundamentally, the NHS has been through huge change over that time, and you know, has in many ways learned how to be a better partner. But I think through the HCT work, you know, much more opportunity for deep learning about what needs to change. And I think today we were just wanting to delve a little bit into your experience as an NHS manager, what you've learned. I believe there's been one or two eureka moments. So perhaps you can just set the scene for us and tell us a little bit about your role working in emergency care in a local system.
Yeah, no problem, Susie. Hi, everybody. I've seen that there's lots of people from lots of different sectors. And so I apologise if this is kind of, you know, coming across as, well, it will be kind of predominantly NHS experience, but I am coming at that from increasingly an understanding of the voluntary and community sector. And I work in different ways as well across the system. But it really resonated with me, this idea of fighting demand. And so I've been looking back and thinking about my kind of personal career in the NHS, which started kind of by accident, really. It wasn't an accident when I think back, but both my parents were public servants in teaching and local authority, and I just sort of fell into temping when I was up in university as an undergraduate in Sheffield, temping for the local NHS up there, and I loved it. I just felt like I'd found a tribe and a family and a group of people that were doing something important. So I joined the National Management Training Scheme in 2003, and then spent 15 years down in the Bristol health system doing various different things. But first of all, after the training, I was a hospital manager, and I don't know, I'd be really surprised but really excited if there are any kind of day-to-day operational managers on this call, because the thing that marks that time out for me was absolute complete lack of time. And when I say lack of time, I developed a UTI. You just don't have time to go to the loo. I broke shoes, constantly running everywhere for years and years. Really enjoyed it, but absolutely frazzled doesn't even begin to describe it. And yet so interesting, so exciting, so much that I learned before then moving into commissioning and system level transformation in the kind of wider Bristol healthcare system. And as Susie said, I kind of found myself in a transformation role for those of us that have been in the NHS during yet another restructure, where I was heading up 3 CCGs worth of urgent care system management, and just the day-to-day slog, despair, difficulties of drawing the system together and trying to deal with system-wide issues of who's in what bed and how many ambulances were there, and trying to keep a personal sense of what was going on for people within that. And then in 2018, I moved over to the Gloucestershire healthcare system, and I'm Gloucestershire born and bred. You might pick up the accent, but when I'm around people from Coventry, I start to pick up my kind of Redditch twang instead. But I moved up to Gloucestershire on a kind of transformation program director portfolio, but it was a sort of open, whatever big programs they were going through as a system, I was kind of to be assigned to. And so I went over to the hospital trust and worked for a few years on their hospital site configuration, because there are two main acute hospitals in the Gloucestershire system. And then because I was so fortunate, because I had this open portfolio, I was moved, when that came to an end, the person that was covering the self-care and prevention role was on secondment, and so the ICB, what is now the ICB leadership, asked me to take that brief on, and so off I went, and suddenly things connected for me in a way that I'd suspected they needed to for all those years beforehand, taking on a prevention and self-care brief, but that included thinking about health inequalities, and it included thinking about our relationship as a system with the voluntary community sector.
And so, Jo, so that's a lot of information there, and hopefully people are following that story. And as you say, everyone has their own story about what experience they come to a new job with. What did you think that job was really about? When you took that job on, what did you think you were there to do?
That's a really interesting question to reflect on, because I had been an operational manager, I'd been a transformation program director, I'd done a lot of change management, and I saw it as a program or a portfolio when I first started. You know, there's a load of things here, there will be deliverables, there will be things that we need to organise, there will be stuff that we need to manage with the program management office within the system, and I saw it as a very kind of rational thing. And as I discovered and delved into what was really going on in prevention, and as I started to link that with both my personal and my professional experience, I saw that it was much more a way of being than a programme to be managed, and started to learn a lot and unlearn a lot about how I had expected to approach it and how we needed to approach it. And that really resonates with the goal of Healthy Communities Together, I think, as well. So
can you tell us a little bit more about when you say it meant more about being? So you're a busy operational manager, you're getting more senior roles, you come into this role. What does being look like? How does that feel?
So, I mean, there were a few things that kind of helped me towards that route. It wasn't a kind of, oh, I've just transferred jobs and suddenly I have to kind of, focus on the being, not on the doing. It was a kind of gradually emerging thing, particularly in sort of unpicking what actually we'll be talking about with health inequalities, and not quite resonating with the sort of national drive for kind of health checks and sort of doing two sort of approaches to health inequalities. And I really started to kind of unpick with the team and with public health and with the voluntary community sector, what was it that we were actually kind of asking of each other, and what did we need to do? And I'll come probably back to it, but that's where I kind of came across thinking about this in a kind of complexity informed way, which is what I would talk about. But there was a sort of light bulb moment when I was thinking about the sort of fighting demand, the constant pressures within the system of elective recovery and of emergency care system demand, when I just sort of connected it to my experience and thought, oh, there's a different way here.
Can you say a little bit more about connecting it to your experience?
Yeah, sure. Is it okay if I just share my screen? Because there's a slide that may sort of look familiar to people if I put it up, as long as you can see that.
Right. Can you just explain to people what this is a little bit, Jo, for people
so
who
what I'm showing, and for people that don't look at this kind of data a lot, the healthcare system has loads and loads of data, and one of the bits of data that we have is who has been admitted to hospital, and we know, because of postcodes and all the demographics we collect, we can kind of assign those people. We can look by gender, we can look by date, but one of the things we can do is look by assigned national deprivation decile to who's been admitted to hospital. So what I asked our analysts to do in Gloucestershire was have a look at emergency and planned hospital admissions over a period of time, so a year. It's going back into 2020 now, and along the bottom of the graph you can see deprivation decile. So number one on the left is the most deprived people in Gloucestershire, and over on the right hand side is the least deprived people in Gloucestershire. Gloucestershire, it has to be said, is overall not a very deprived county, but there's some very, very deep pockets of deprivation, statistically speaking, in the county. And then these two lines, so the green, and what we looked at is total admissions, and then I just asked them to split what's the proportion for each decile, how many people are admitted as a planned admission, how many people are as an emergency admission, and what we got was this sort of hairpin going on. So red is emergency admissions, green is planned, and there's just so many questions within there. But the first thing that we did is just go back to the actual people, the actual numbers of admissions, and just started thinking kind of, well, that obviously doesn't look right. We know in healthcare that it's better to try and plan. It's better to try and access planned care. There's more you can do. There's more prevention you can do. You catch people downstream and you actually have a chance of kind of improving and supporting them. And urgent care is firefighting. Literally, we're talking about firefighting, and that's where we are with this graph. And so we worked out that if you wanted to get that sort of flatten out, so you've got parallel lines on that graph, and so that inequity isn't there, you'd need to sort of roughly get to around 45% emergency admissions for the lower deciles, and that equated to an average of 34 fewer admissions a day in our system. And that's when I literally couldn't believe it, because I just went back to my experience in Bristol and how hard it was every day to find 5, 10, 15, 20 patients to move on into different systems, ambulances queuing up. And I thought, wow, to me then, I thought the answers to all of the things we're doing around the urgent care system, obviously it needs to be same day emergency care and 111 and all the other things that you put in place. But unless we look upstream at the why, and then the why, and then the why, and then the why of what's happening to people and why is it so different, we're not gonna change anything. And that's where prevention and urgent care came together for me.
So, right. And
I'll
so
take that down for you now.
How did that feel, Jo, when you saw that graph and you realised the enormity of actually what the task was? Because talking about going upstream is, it's an easy thing to say, but actually we know it takes a lot of partners and a lot of consistent effort.
I'd heard it a lot, going upstream, and I kind of thought that was kind of somebody else's job, somebody in prevention or public health, and kind of we just had to deal with whoever came through the door. I never really thought of it as mine, so it was like a rug being pulled from under my feet. I found it massively destabilizing, but also I was really lucky because I was in the right place to be discovering some of those answers as well. But it has been a journey of unlearning, particularly when you're thinking about health inequalities. So my old manager in me would look at that and go, okay, who are these people? They must be high impact users. What schemes can we put in place? And that's all right. It's just that there are more things to be done much wider than the health and care system, which many people I'm sure recognise. I'm not special. People understand this, particularly colleagues in the voluntary community sector understand this really well, that unless you look at the whole context of where somebody is, you can't even begin to understand why 10 years later I might end up as what we might call a high impact user in the health and care system.
So was this quite unsettling for you as a leader in the system, given the things that you'd been you'd measured maybe success on before? Yeah. You're then talking about unlearning. So yes. How did that feel?
Really unsettling, really destabilizing. I think, when this is where I said earlier about kind of switching to a complexity informed approach, one of the things that we've been working on a lot in Gloucestershire is kind of understanding that certain problems, certain phenomena in our society, such as inequalities and health inequalities, are complex. And I know I've said in the past as a manager, I'm great at managing complexity, and suddenly realizing that the very thought of that is just anathema. You can't manage complexity. You have to sit in the messiness of complexity. You have to be prepared not to manage it and not to harness it, and to sit in it and kind of be prepared to be vulnerable and humble and ask questions and discover stuff about yourself and about other people and about the way that the society works. That really, really uncomfortable. But the thing that I discovered was I can't program manage my way out of health inequalities, and I can't program manage the reasons why that graph wasn't doing the right thing on the left hand side. That was much more about relationships and about spending the time to know stuff that I didn't know.
So how did you deal with the tension of the things that you used to rely on, program management and things to get you out of this, were not going to deliver for you, and you were going to need to invest more time in your relationships? How did you create that space to be able to do that for yourself and for others?
again, I was really lucky, Susie. I've spoken about my previous career, and I know this wouldn't have been possible as an operational manager, but I was really lucky with the prevention self-care portfolio that I could put stuff into place straight away. We were already doing a lot of work and thinking about what does it really mean when you say relationships are the work? How do you show up and make work and relationships synonymous? And so one of the things that I did was have a chat to my boss and say, I really don't think, although I really feel it and I really believe it, I don't think I'm doing it. If I look at my calendar, work is the work. And I'm not valuing the time that I spend knowing people and getting to know people. And particularly, I most often found getting to know people when I've got an agenda, when I need to go and sort of do a project or allocate some funding or something, and I'm not spending time with people, just being there. So one of the things that I did was say, well, I want to spend a third of my time and really challenge myself to spend a third of my time in relationship with people, as non-agenda driven as I can possibly be. So not going to see somebody because of something, but just being there. And that's impossible to do across a whole county. So I particularly spent some time in one of the wards that sort of appeared on the left-hand side of number 1 in that graph.
Can you therefore tell us a little bit about how that felt for you, but also what were you met with when you said to people, I'd like to come and meet with you, but I don't have an agenda? How was that received?
I think everybody's got used to working in a certain way. My reflection is that colleagues from voluntary and community centre sort of expect to receive a certain thing when somebody from the statutory sector comes, and have a mindset about, it might be about funding or wanting something from it. Honestly, they were surprised to see me, but really pleased. I got lots of comments kind of, we've been asking for we don't really understand why you're here, but we were asking for ages for the NHS, or, you know, there's not very much delineation. I've known the NHS for years and years, but there's not very much delineation if you don't have the kind of blue badge on about what the NHS is. So we've been waiting for years for somebody to come, and now you're here. We don't really know why you're here. but and then I was there going, let's just talk. Let's get to know each other. I don't actually have an agenda. I just want to understand what it's like to live where you live and what you do. I'm happy to share what I do, and that was the main thing, is just I found that really hard. So we had a monthly conversation we set up. This is all during COVID, so it was virtual as well. So it's really difficult to be personal and personalised. But we spent, they all really wanted to. We had a load of kind of community voluntary sector organisations that really wanted to chat. And we really deliberately just spent time together for a couple of years, we'd chat, and I had to really hold back my horses of like, what are we doing here? What's next? What's the plan? What did we say last time? What are we actually going to do with this time together? And over time began to see how massively, profoundly valuable it was to have spent the time building that trust with each other.
Can you give us a description of the value of that, or just give us a couple of examples of where you saw that value? Apart from the experience of how it was and the relationships, what value do you think you got out of that?
Well, I think it just, firstly, you can't buy trust, you can't switch trust on and off, and you can't put a price on it, really. And I think the fact that we turned to each other subsequently over the next couple of years, and I'm now don't work for the NHS, I'm independent, but I am doing some work with that system still. Just because we could ask for advice, we could ask for support, we could say, so quite a lot, they would get in touch with me and say, oh, you know, we're having some real problems with kind of, you know, new mums not being able to get to health visitor appointments, for example. That would never have, I wouldn't have talked to them about health visitor appointments, it wouldn't have come up in the stats as being a particular issue. But because we had the kind of community arm of our NHS offer in Gloucestershire there, they arranged to set up it was just a baby weighing clinic. It wasn't rocket science in the community group, but it's massively changed. These mums weren't getting their babies weighed, they weren't connecting because it was in the community centre. They then were supported to go off and set up other stay and play groups and everything. So from if we'd have tried to do it because we wanted to do a project on improving baby weighing, we would have had a different outcome. But because we were, I would say, friends, and they were coming across something, we could do something. And something similar has happened with smoking, that they locally are really, really concerned about vaping and smoking, and have come to people in the NHS to say, we'd like to work with you. We don't know what this looks like, but we'd just like to work with you because you know some stuff and we know some stuff. But if I'd have gone to them 2 years ago and said, oh, your smoking rates are really high, let's do something about it, I think the reception would have been different, and probably the outcomes would have been really different. So some really tangible examples for people living in the community about what mattered to them and what they wanted to do with us.
Thanks, Jo. I'm conscious of time and we want to get people into groups so that they can actually talk about their lived experience of trying to build relationships and how much time it is possible to do that. I'm very conscious that you had reached quite a senior level. And you said earlier, well, I think this would be difficult for an operational manager working in whatever setting. What advice now, given where you are in your career, and you're saying you're now independent, what do we need to do to actually create space for people to build relationships, regardless of what role they have in any system, or regardless of how senior they are? I mean, you and I chatted a couple of days ago, and in my experience as well, as an operational manager, it felt like it was only senior leaders, it was only the privilege of senior leaders that got to do system leadership and got to do this kind of work. So what advice do you think you would give to the younger leaders now about the value of this?
I mean, you're right, it's so hard, and advice can fall on stony ground if it just doesn't feel like you've got the permission. So talk about it with whoever's your line manager, kind of, you know, like I did. Like, my line manager didn't set me an objective to create space and build relationships. I said to her, I think this matters. And I was lucky to be able to say a third of my time because of what I was doing. But even consciously thinking anytime, you know, who is it that I don't know? What place in my system do I feel is getting a raw deal in services? And do I know anybody that knows that place? Could I spend any time? Could I consciously, you know, spend, even if it's just sort of an hour a week or something, thinking about that and being in touch with them, or go visit them, and, you know, when I'm not at work. But I think it's just that really trying to set yourself a goal of being there. Yeah. That's so hard. It's really hard. I do understand.
But as you say, there's various people on this call who are managers of teams or of individuals, and actually the role that we have as leaders to ensure that we're having those conversations and that we're creating space for people in our team to be able to do this, and valuing that as core work. Thank you very much, Jo. I'm sure your story will have resonated with lots of people in terms of kind of some of that experience, regardless of what setting people are coming from. I think I'm now handing to Debbie and Chloe to put us into groups.
That's right. And thank you both so much. And yeah, Jo, I know I met you at one of the Healthy Communities Together events and was inspired by some of what you were saying then. And just to hear that completeness, that full story, I think hopefully it's just really challenging, and hopefully has really whet people's appetite for a conversation. So thank you for that. So we are going to, in a moment, magically go into breakout rooms. Chloe's working the technology behind the scenes into random groups, and we're asking people to think about 2 questions which will pop into the chat, but they're essentially, when we think about the future of health and care in 5 or 10 years from now in our system in Coventry and Warwickshire, what is it important that we start to do differently today? That's the first question. When we think about the future of health and care, what do we need to start doing differently today? And then how do we move beyond a health and care system that's always fighting demand? So, you know, the challenges that Jo's just talked about, but also that I know everybody on the call will be really familiar with, just firefighting. How do we get beyond that? So those are the questions that we're hoping people will have a really good discussion about. I think we're going to go into breakout groups until about, we've got a good chunk of time. We're going to come back together at about 1:20. So we've got a good amount of time for conversations, and then when we come back, we're going to ask, I think Susie's going to facilitate a bit of feedback from groups and some reflection on what we've been hearing and discussing. So I'll let Claire, your way begin.
Just to add to what Debbie said, if you can make sure there should be one person from HCT in each breakout room just to help conversation flow, but there's quite a lot of us, and we may be spread too thin, and you may end up in a group that doesn't have us. So you'll be a self-run group, which is a great thing. But also just a reminder to make sure that you nominate someone is aware during the discussion that you're going to bring back a few key reflections from your conversation. So if you could make sure that someone from the group agrees to do that, that would be really helpful.
Okay, Chloe, I think we're good to go.
Great.
Yeah.
Okay, well, welcome back. There's 34 of us still joining this afternoon. I hope you had good opportunity to meet existing colleagues, maybe meet some new people and have a conversation. We've got about 10 minutes or so now to just hear some reflections back from the group. So just encourage people to come off mute, introduce themselves, and just perhaps give a reflection of what was coming up in your group. And Joe's also going to join me for this and may well kind of react or ask questions. So who would like to go first? Please just unmute yourself and tell us about your conversation.
I'll go first. I'm Francesca. I'm with Voluntary Action Coventry. During our group discussion, which was excellent, by the way, we kind of focused on what Joe was saying about that relationship building and how everything came down to that, really, about that genuine relationship building and working together and understanding different positions, and how actually previously there's been quite a lot of competition, I suppose, either between the third sector organisations, whether it's competition for funding and things like that, or resources, to NHS versus the third sector, or statutory services versus the third sector. And actually it's something that we really need to totally drop, you know, and realise that it is about building those relationships, and it's so key. And I think something we also talked about was how, you know, that phrase, it's not what you know, it's who you know, and not in a cliquey way or in a, you know, I've got all the contacts kind of a thing, but it is so important that organisations are connecting on a personal level, you know, because it is a person you're dealing with, it's not an entity, you know, you're not dealing with an entity, an organisation, it's that direct connection. So a lot of our discussion focused around that.
Thank you. It's a really interesting reflection, because that competition will exist, as you say, between groups, between organisations, between people, and in some ways there's something about acknowledging and surfacing that is part of what we're all dealing with. But actually, by building and strengthening those relationships, we can overcome some of the negative things that come with that competition. Joe, does that reflect with your experience when you were working in the Gloucestershire system?
It absolutely does. And I would also say, kind of, if it's kind of bringing it back to ourselves as well, and thinking of a relationship that you're in that really works. It's not easy. Like, it's not all lovely. It's not all, you know, holding hands and skipping around and enjoying each other's company. When you're really in a relationship that matters, it can be really difficult, it can be really revealing about yourself, it really revealing about the other person. You can conflict a lot. You have to learn from that. So I think it's kind of being patient with the fact that relationship isn't an easy thing to do. It's not an easy thing to be. Yeah.
And we've got Eleanor chatting in, saying that they talked about it in their group, and about how you have less of the hierarchy. How do you flatten the hierarchy wherever possible? Who'd like to come in next with reflections in their group?
Follow up. I was on the same group as Francesca, so one of the points in the discussion areas we had was around how we support managers, how we support people to work in that different way and take those times to build those relationships. So Danielle was suggesting that, you know, we perhaps need to look at recognising managers in statutory organisations need that support to learn those new skills, new behaviours, and how we do that is something perhaps we can look at in terms of answering the question of what could we do now.
Yeah,
and see how we can support that, because it feels like there is a motion of people, a group of people who are trying to work in this new way and show humility and build relationships, and part of that is that it takes time, and the results are a long way down the line. So in a world where in statutory services where we're measured almost immediately and against definable things that we measure currently, it's this bit about how do we value things different to measure, and what are those different things, or are those new measures that we might need to introduce? And then how do we equip managers to show that leadership style, to recognise and appreciate and be able to do this new way of working, of true relationship building, not saying we're doing relationships.
Yeah, and so what I'm hearing there, Andy, is that there was a sense of kind of shared commitment by the people that were in your group to say, actually, there's work we could do together to create that space and help others that we work with to work in that way, because we can see the benefits of it. So how do we share and create some of those conditions that means that people can more readily build their relationships?
That's right.
Yeah, fantastic. Anybody else from that group want to add anything else in?
Yeah.
If not, oh
I
yes,
would just add that we also talked about the importance of rigour as well, because this is seen as maybe not mainstream in terms of the way that we work, but actually it does need to become that quite quickly if we're going to really achieve transformation. We're going to need to be able to have evidence of why we're working in this way, why we're making changes, and also be able to see the impact of what we're doing. So the relationships are important, but we do need to put some rigour alongside it. So agreeing how we do that and what we're looking at as you know, proxy measures of success, and how we know that it's achieving the desired results is an important piece of work, which our system has said that it wants to do.
Yeah, so Daniela, what I'm hearing there is that you're saying that you need to have some rigour and some evidence and some things to demonstrate what these relationships are delivering, but and with that also presumably comes transparency as well. So not, you know,
yeah,
how you are sharing the learning as you go along, because it's not going to be neat, as Jo was describing from her story. It's messy.
That's right. But you know, in a world where certainly managers working in statutory sector organisations are measured on things that are happening in the here and now, and you know, and that comes down from nationally. If you can't justify what you're doing, you only need a harsh winter, and the focus is taken away from that, and you're back onto, you know, ambulance handovers, etc. And so there's lots of reasons why you need to have rigour. We all need to know that what we're doing is having an impact. We also need to justify the new way of working on and on until it becomes, you know, a no-brainer.
I think there's an interesting paradigm shift that you're talking about as well, Danielle, because I think the predominant way of looking at things from the statutory sector is kind of start with the end in mind. You know, in order to be able to demonstrate it, you need to say what it is, and then you need to be able to show that you've got there. I think one of the things that we found that we had to unlearn, particularly when you really think about co-production, is you don't know, you know, you don't know where you're going to go if you're going to co-produce something. Like I was saying, we couldn't have said 2 years ago that we were going to design a different approach to sort of support to stop smoking in an area, but we certainly did, and we could show the benefits of that. But if we had set out with the end in mind, then we would have gone to a different place. So I think it's just worth recognizing, remembering there is a paradigm of kind of set it out and measure, and it's really important to show, but sometimes you need to allow yourself the space to not know. That's what's really hard. I'm not saying the whole world needs to be like that, but how do you create a space where you can sometimes be in a place where you don't know, and you collectively share the riskiness of not knowing, and you think about who's carrying the risk here, because it may in that situation be the statutory sector partners that carry a lot more risk because they're doing something unexpected. Thanks,
Jo. Got Rachel with her hand up.
Thank you. So I was just going to feedback from our group. It's fascinating how overlapping our conversations have been. Yeah. So that, yeah, there's sort of the talk about building relationships and not having the end in mind. A couple of the themes that we really picked up on was actually about supporting people to have you know, agency, and then we talked about actually shifting power to communities, but recognizing that actually people might need the support to get there. You know, so we talked about individual coaching, but then, you know, almost at a level of community, you know, community type coaching to support people to sort of then, you know, take on that power. So we're not doing it to them, you know, not having the end in mind. This isn't about us leading it at all. And I think one of the key things we need to watch out for is that we don't try and programatize this, because that's what we love doing is taking that approach, but having that real trust in communities and allowing things to not work, but actually try something else. And that really is shifting that power base. And then there's been a couple of mentions in terms of outcomes and proxy measures and, you know, that rigor around that. And we were very keen that we stopped thinking about poor health, because we really like measuring poor health outcome measures, but actually thinking about how we capture well-being instead.
Great. Rachel, was there any sense of kind of what was around an urgency, or what you'd like to start doing differently today? Was it that health coach, was that coaching in community space?
Yeah, I think that's really what, and recognizing that, you know, some of that is happening, you know, that's already happening through healthy communities together. You know, Sarah talked about, you know, some of the work that's already going on with that, but it's a shift of mindset. Yeah. So it's not going to say, this is where we're very keen that we don't programatize it, say, right, that's what we're going to go and do today. But it is, and, you know, others have talked about that support for the workforce to work differently. We also need to make sure the support from the leaders within the system to allow people to work differently. Yeah, absolutely. Thank you very much for that, and for reflecting from your group. If anybody else from the group wanted to come in, if there was any point that they wanted to add to, or we'll hear from another group. Did similar things chime? Is there anything new or different that you talked about, Valerie?
Yeah, shall I come in for our group? So yeah, really similar conversations. We talked a little bit about hierarchy and you know, the idea that things that, you know, because one of the reflection points was around, you know, urgent and emergency care, and how do we redress that? There is something about the system will always focus on that, and there's an urgency to that. There's a hierarchy that is the most important, and as you go down, you've got your community care and then your community and voluntary sector. That it's almost like the stuff that happens further down and the softer stuff doesn't matter as much. And I think that's a culture shift that we need to address, because otherwise we will be in the same situation every winter. And we need to get away from this idea that this broader relationship stuff, it's an add-on, that it's a nice to have, because equally then it's the first thing that we lose when there's funding cuts. And I think this is a cycle that I've seen a number of times, you know, over the last couple of years, that, you know, we find funding for this, we have the conversations with community, we build that trust, the funding goes, and then we lose that. So I think we just need to be really careful about that when we're fundamentally doing something differently, rather than just just adding a bit of funding down here, which may or may not, you know, be there in, you know, 3 or 4 years' time. We had care navigators on our team, which I think that was a really good, really nice to hear their kind of frontline experience of how you work in a person-centered way. And that it's not, and that's, you know, not something that's driven by outcomes. It's person-led. What does your good health look like, and how do we get there, and how do we involve, you know, the whole community asset to do that, and the importance of having that kind of hyper-local network that tentacles into the community, that, and as Rachel said, it definitely can't be programmatized because it looks different in every neighbourhood in Coventry. And how do we ensure we recognise and reflect all of that? So really not easy to do, and really not easy to do either in a programmatized way or in a way that's expected to work to outcome measures. Yeah. So again, it's a shift in culture to allow us to do that, isn't it? Yeah. Don't know how coherent that was. If anyone else from our team wants to come in, feel free.
Anyone else from Valerie's team want to come? Thank you for those reflections, Valerie. And I think, you know, what I was also hearing there, you saying is, you know, in the thick of winter, would it be possible to have a meeting like this? Would we create space to be talking about our relationships? It's a good challenge. Another group like to come in and offer their reflections? Any thoughts that you had about what could be done differently today to build a different future for the Coventry and Warwickshire system?
Yeah, I don't mind going next.
Go for it.
Hi everyone, I'm Charlotte Walker. I'm the Senior Comms and Engagement Manager for the ICB, previously with Gloucestershire ICB, so I'm very familiar with Joe's work and all the brilliant things that they're doing over there. So quite similar really, our group talked a lot about relationship building and the need to really protect time and encourage staff to do it. That sort of leading from the top, leading by example, but also to, you know, acknowledge that those relationships between nurses and the third sector and the voluntary sector is really important to that personalised care and really embedding that. So I won't go into too much detail because obviously we've heard a lot about relationships, but we also talked about the need to build trust between organisations. So really trying to drive that one Coventry and Warwickshire voice so that we're all talking about this system as though we're working for the same organisation. I think it sometimes ends up that we're clustered and we're siloed. We're talking about our own world and our own priorities and not really thinking about the bigger picture stuff. I think we probably raise more questions than answers on that one on how we actually get there, but for us that was sort of one of the key priorities. So embedding integration to really provide that joined up care so that we are working as one system was kind of the other thing that we thought was a key way to move forward, because it's, you know, like I said, we seem to be operating in clusters and we don't really acknowledge that one voice as well as we could.
Yeah, thanks, Charlotte. I mean, you being very honest there about the reality of it and the silo working, which we hear a lot from many systems, but I guess how you continue to stick together to work through how to get that sense of the collective much more, and how you challenge each other when that seems to be, you know, deviating from that. Yeah. Anyone else from Charlotte's group that wants to add anything else? If not, is there another group? I'm conscious I'm keeping an eye on the time as well. How are we doing for time, Claire?
I think it's okay. We'd allowed 20 minutes for some calls to action. I probably don't need as long as that, so keep going.
Can we let this run for another few minutes then?
Yes,
yeah, brilliant. Okay, I think Eleanor, you had your hand up.
Yeah, and apologies, I've used the clap function instead. So yeah, just going to reflect back on for our group. I think we might have been group number 6, but Kevin from the ICB started to talk about in another system he'd worked with something called the economy of together. And I think that's an opportunity that we could start today. And it was essentially starting from a moral position following kind of COVID on how are we going to work differently. And I think that still chimes now, and that the answer to that is collaboration and integration and the need to tackle health inequalities and working across partnerships. So kind of our conclusion was around those partnerships need to reflect the wider determinants for individuals in our communities, so housing, faith, BCSE, health, social care, and that how we want to make sure that services are more equitable, but that in that patient or service user journey of being able to step up and step down, that we kind of need to move away from organisational boundaries on this is our caseload and thinking much more about how do we respond to that patient, our population need, and that there will be different partners weaving in and out at different times to meet that individual's needs, and around how we can help people to feel held, and that we as leaders and at any level of an organisation need to be bolder and braver. We talked lots around the importance on quantitative metrics and how do we measure some of the qualitative metrics from kind of today and building relationships. And I think our answer was that we need a shared vision that we can all collectively get behind with some tangible short and medium term actions to really make and enable and help us to act and think and work differently.
Thanks, Eleanor. And can I ask you, how was the energy in the group? Was there a sense that this was possible? So because of the question we're asking is, you know, what do we need to do differently today in order to build this new future? So did it feel hopeful, that conversation?
It did feel hopeful, and I think a bit that I hadn't reflected was the importance of data. So we've got healthy intents and kind of population health management data, and using that across organisational boundaries for us to think about needs and solutions in a different way. So no, it did feel hopeful.
That's good.
I don't know if hopefully others will agree. We had Gemma, I think, and Helen, Lexi and Kevin.
Thank you very much for representing some thoughts back from that conversation. And Jo, just that data question was obviously something that you reflected in your story.
Yeah.
Do you think there's some more work we need to do to actually help people about how to look at data? I don't know about you.
Yeah.
It took quite long into my career before I really understood how to look at data properly.
Absolutely, and I think the thing that I've learned is the destructive and power of data when it others, people and working with communities who are defined by the data that says they're deprived. They don't own that, they don't want it. It causes problems for young people when they come from those areas. So I think being really mindful. Gloucestershire held a day-to-day a couple of weeks ago, and the chief exec of the National Audit Office spoke to one of the community leaders in the community that I've been working at, actually. And it was a very emotional conversation, like he really hadn't realised how destructive this apparently useful data can be when it's applied to somebody that for whom it only tells the tiny bit of the story. And I think we could probably all relate if we think about kind of data that's about us, that doesn't necessarily describe us. The other thing, Eleanor, that made me think about was Dr. Chris Bentley, who did a lot of work on the population intervention triangle, which lots of people might have come across if they work on health inequalities. But he spoke to us in the Gloucestershire system about the metaphor of a shirt. You can have really beautifully tailored kind of cuffs and collars and fronts and back pieces and lovely buttons and everything, but if the seams are rubbish, it falls apart. And so for me, that translates to me to having a how approach, you know, the what really matters, the wonderful services and how they work. But if you don't concentrate on the seams, if you don't concentrate on how they're stitched together, they can be as strong as you like and it won't work as a whole garment.
Yeah, thanks, Jo. So Claire, I am really conscious of time, and we probably haven't got around all the groups, but is there any other group that's got something burning they want to add to this conversation? We're not going to lose some of the things that you talked about. So
can I quickly come in, Susie, just to feedback from my group? And I think a couple of points. So we had mainly sort of voluntary community sector groups that sat around our table, and that point about what you were just saying about the data, and it was interesting, Jo, because I think one of the most powerful points made was by Last, who works with is it Inini, the refugee and migrant community, and actually just talking about how we need to make that time to really listen and understand communities and understand the social environment. And so, you know, you've got patients going through a revolving door and being put back into the situation that broke them, and how much time do we actually invest in properly listening, understanding the context in which people are living. So I thought that was really powerful. The other reflection I had was that there was a comment, for us coming from outside of the system, it can be quite hard to demonstrate the value of what we do. And it was just those words, from outside of the system, and how do we start to make everybody that's represented in this room and all the different sectors feel part of the system, and not feeling like they're having to strive to make their voice heard or compete for funding or be locked into short-term funding, all those sorts of issues. How do we come together as being all part of a system that can really make a difference to the communities that we serve?
Thanks, Debbie. That sounds like a really good point to hand back over to Claire, because what you're talking about is we are the system, and who's the we, and how are we making sure that we're continuing to invite people into those conversations, and that we're being, you know, truly inclusive in terms of the way that we work. And thank you all for the conversations that you've had. I'm conscious we won't have done justice to them at all. I hope this is the start of a continuation of more of these kind of conversations. And thank you again for taking the time today to be with each other in this way. And for the team that have been putting this together, I'll hand you back to Claire for some next reflections and thoughts.
Thank you. Trying to change. Oh, well, never mind. Oh, right, view. Great. Okay, I'm back in the room. Well, first of all, I want to say thank you to Jo and Susie for being so generous with their time and their reflections, and running essentially two parts of today so ably. We really appreciate that. I think this has been a good way to celebrate NHS 75, by the way, this gathering today. I want to end on, as well as with thanks, with some calls to action, really. First of all, I've been asked a very basic one, a very simple one. I've been asked if everyone who's here is happy to share their emails with everybody else who's here, so that you can stay connected as a group of people independently of us as organisers. So yeah, we're getting thumbs up about that. So unless I hear otherwise, I'm not sure that's the right way around, but unless I hear otherwise, I'm going to assume that everyone who's here is happy to share their emails. Put it in the chat box if you'd rather not, but yeah, okay. Thank you. Right, I'm making that assumption and I think it's been heard. Who do you want to continue this conversation and look towards developing some action from it? If you are up for that, please put your name in the chat box, because we will follow up with you and think about that. I'd also be keen, if we are going to continue this conversation, that we get some volunteers to help us to run this next time. So again, if you want this to continue and you're also up for being part of making it continue, please put that in the chat box. So I'm just going to see what's happening in the chat box. It's quite hard to be in the room and keep an eye on the chat box at the same time. Great. So Lexi is saying she'd love to be involved in conversations going forward. That's brilliant to hear. Helen Mosley too. Thanks, Danielle. So the chat box will run for another few minutes. So please, if you want to have more conversations of this kind and or be involved in organising conversations of this kind, please put your name in the chat box. I'm going to email out everyone who registered but didn't come and everyone who registered and came with an account of what happened today, some of the main points, some of the jewels from the chat box, and also a link to the recording. Again, finally, I'm just going to say, look, if you want to support the work of Healthy Communities Together in Coventry and Warwickshire, or if you just want to kind of come and talk to us and find out a bit more, again, if you just put HCT, find out more in the chat box, we'll get back in touch with you specifically for a bit of a one-to-one conversation. Great, I think we've actually got 10 minutes left. I knew that we would have a little bit of time left, but if everyone's happy, has had a chance to say what they want to say and has had a chance at putting their name into the chat box, I think we should be able to wind down. Great.
Loads of people in the chat box who want to help and be part of it.
Brilliant. So
yeah, Claire, I'd just say it's just amazing, isn't it? There's obviously no shortage of people already doing really great kind of transformative work, whether that's kind of one-to-one with individuals or at a community level within their organisations, and just this kind of coming together. There's no shortage of enthusiasm, of absolute buy-in to this kind of relationships, of us being able to work differently and to do something sort of that's really transformative. So I guess we now are on, you know, we're already on that journey, and this is another phase of that journey to say, you know, what is possible. And when we're in those difficult, either not being able to go to the toilet, Joe, because you're back to back with meetings, or you're just on that run around, or you're working in really difficult situations, I guess it's kind of please hold this meeting and this sea of faces at the forefront of your mind. Or I look to sort of Bill and Kevin and others, when you're sat on board meetings making those really important decisions, then actually, you know, remember this sea of faces, because there's a whole community of people that are in our system that are wanting to see this transformation and this change. So hopefully this has been a positive coming together to help us all as individuals as well as a system. So thanks for giving your time.
And I would just reiterate what Susie said, really, that she was hearing that we are the system. So this sea of faces is the system, and you do have power. You do have the power of action. You have the power to go back now to your teams and have a conversation about this conversation, to think what you as an individual might do differently, however big or small that might be. We all have some agency and power in this system, because we are the system. So I think with that, I'm going to say goodbye and thank you all for your time and your energy and enthusiasm today, and all the contributions you've made. We really appreciate that, and we will be back in touch.